Knock, knock, knock. Hello, my name is Matt. I'm going to be your student nurse for today.
Hi.
On gloves. How are you doing today, Nikki?
I'm doing well today.
Good. If I could I see your wristband? And if you would, just give me your date of birth.
May 5th, 2001.
Perfect. And we have baby Olivia here, right?
Yes.
Awesome. I'm just going to check that wristband down here to confirm. And yep, that is baby Olivia. Today we got you up for a newborn assessment. Is now a good time for that?
Yes, it is.
All right, perfect. Well, while I'm just initially looking at baby, the color appears to be normal. I'm going to start off just listening to baby's heart sounds, lung sounds, and his bowel sounds. So it'll take about a minute for that.
So we're going to do another reflex where I'm going to turn Tammy's head to the left and the right side of her body should go good. Also same here, going to turn her side to the right. All right, good. And then we're going to move down to the extremities.
All right. Lungs were bilaterally clear to auscultation, and the heart, I did hear an S1 and S2 with no murmurs, and the bowel sounds were normal active, which is good and normal, so no problems there. So starting off with the baby's head, I'm going to feel for the sutures, and they are overlapped, which is normal. And feeling for the fontanelles, they are flat and soft, which is also normal. There doesn't appear to be any caput or cephalohematoma, which is good. Baby's head is a little bit coned, which is normal, and over the next 24 to 48 hours, baby's head should come back to be a more round shape over time. Moving on to baby's eyes, there doesn't appear to be any jaundice or draining. And looking from the corner of his eye, it does line up with the top of baby's ear. Baby's ear doesn't appear to have any skin tags or redness or dimpling, which is good. Moving on, baby's nostril airways are patent and clear, appear symmetrical, no nasal flaring, which is good and what we like to see. For baby, we're going to start off with his sucking reflex. I'm going to put my finger in here, and he should wrap his mouth around my finger, which he does as normal. And then we're going to check this reflex right here. I'm going to touch the corner of his mouth, and he should turn his head to the side that I touch, which he did. Check the other side. Perfect. Baby's head turned. Now I'm just going to feel inside, make sure that baby's mouth is soft and normal. And we're just going to look inside. Mucosa appears to be pink and moist, and there are no Epstein's pearls, but if there were, that would be normal and no issue. Going down to baby's neck, it appears to be normal, no bulging or distension, moves pretty easily. We're going to do as tonic reflex. So when I turn baby's head to the right side here, his right leg should extend, and vice versa for his left side, his left leg should extend. So that's normal and good. Next we're going to feel for baby's temperature underneath his armpits. So usually we like between 97.5 and 99.3 is what we like. Baby's temp is within those ranges. Next we're going to feel for his brachial pulses on each side. Those are strong and normal. We're going to do hand grips for baby here. Baby grabbed them equally and strong. We're going to take a look at baby's hands right here for palmar creases. It looks like he's got about 2 on this side and 2 palmar creases on this side as well, which is normal. Looking at baby's chest and clavicle, his chest does appear to be a little swollen, but that's normal. That can be due to hormones from the mother, and that will go away over time. Just palpating the clavicle here for any crepitus. Doesn't appear to be any. Like I said earlier, perfectly normal S1, S2, no murmurs. Breathing appears to be non-labored. Moving down to his abdomen, as I palpate, it's soft and non-tender, which is what we like to see. Now we're going to go down to baby's umbilical cord. So we're checking for any odor, any drainage, any redness, anything that maybe can indicate something like infection. But baby's umbilical cord appears to be clear in the area. So we're going to go down to baby's genitalia. So appears to be normal. The labia majora is covering the labia minora, which is normal in babies. I'll lift baby up real quick to check for anus patency, which is normal in there. I don't see any skin tags or anything like that. We're going to check baby's femoral pulse right here real quick. And that is strong and equal. So next we're going to move down to baby's feet right here. So we got 5 digits on each toe. So we're going to start with the Babinski reflex. So I'll go from the heel here to the top. And his toes should all kind of flash out like that, which they do. And we'll do the other foot. Perfect. And now we'll do his plantar grasp reflex. So I'm just going to put my finger right here. And baby's little toes are going to wrap around my finger, as so, which he does. And then we will do the other side. Perfect. A couple more reflexes. We're going to do a startle reflex. So for that, what happens is I have baby and I grab his arms and his legs. And when I let go, he'll spread his arms and legs out like that, like he feels like he's falling. Perfect. Moving on to baby's back. The back does appear to be straight and normal. There does not appear to be any Mongolian spots or birthmarks, but if there were, that would be normal, and they can disappear over time. There does not appear to be any dimpling down by the butt, nor any lanugo, but lanugo is normal in infants. Just a few patient education things. Make sure we have a name tag and security tag. The name tag is just to make sure that we can identify the baby, and the security tags make sure baby doesn't get taken. And we make sure we switch the security tag for every shift on the feet. And we have one more reflex, which is the stepping reflex. So I'm going to put baby up here, and what he should do is he's going to try and naturally take a step with his reflex, which he did right there, and is normal. For safe sleeping for babies, we like to follow our ABCs, which is A, alone, B, on your back, and C, in a crib. So we like to keep babies sleeping alone on their back in a crib as the safest way for sleeping. And for feeding with a bulb syringe, instead of administering it directly into the middle, into the back of the baby's throat, we do it to the side, and that's to prevent any aspiration. But that's all I have for you. If you want, we can have you do breastfeeding, and we can get a lactate score on that here in a few minutes, if that's all right with you.
Yes, that's all right with me.
Perfect. Do you have any other questions before I leave?
Nope.
No? All right. Well, if you do, just call me and I'll make sure to come back. And one more thing, we will do vital signs on your baby before we discharge. The previous vital signs were within a normal range, but we like to do one more set before the baby leaves, just to make sure everything's safe. But if that's all, I'll be back.
All right, thank you.
Thank you.